personal factor that I would consider in this case that could possibly be a barrier would be the patient primarily speaks Spanish, and that could affect communication between patient and healthcare providers, such as the PT or the PTA. And it could be a problem because it could change the way the patient interprets their therapy and understands the importance of the therapy and the goals that he needs to achieve to get back to where he wants to be. A psychosocial factor that could play a part in his therapy would be the patient's spouse was there during his procedure and after his procedure, was there to understand his goals and his plan of care for his assistants at home. And to me, this would be very supportive and very beneficial to his patient care. A socioeconomic factor that would play a part in this patient's care would be he works as a janitor, but is currently unable to work due to the fact that he just had a procedure done, and his inability to achieve functional mobility tasks, and also his need for rehabilitation. This could be a barrier in his patient care because this could possibly be an issue since he could be the main financial supporter for his family. So this could cause a rift in his priority to therapy compared to what he needs to take care of at home. An environmental factor that would play a part in this patient's care is the fact that he has 17 stairs at his to enter his home, and he also has 12 stairs inside to get to his bedrooms. This could be a barrier due to the patient's mobility, since it is limited due to his procedure and the pain he has in his low back. I believe a significant barrier that, if not addressed by a PT or PTA in this patient's case, would be the patient's history of hypertension and type 2 diabetes. Although it says he has it under control with the medication he takes, he does have a history of it, and his family also has a history of it on his father's side. And I believe if this is not emphasized in his plan of care, it could regress his therapy interventions and his healing process. And I personally, as a PTA, would consider these things. That way I can include interventions that would treat his conditions accordingly, that are safe, and that could be progressed without many limitations. A personal bias that a PTA could have regarding this case is the patient works as a janitor, and maybe a PT or PTA would think this job that he has isn't very difficult and really doesn't require much effort. However, these things can be minimized through active listening and just understanding how a patient feels physically and mentally in the demands of his body that is required to make his living. Another thing would be through self-reflection, where getting to the root of why this would be a bias in the first place, and how you can understand that and move past it.